Hi everybody, I'm Magnus Carlson from Magnus Carlson Audio. This is a podcast where real medical professionals discuss fake medical emergencies. That means that unless your doctor is named Strange, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor.
Hi everybody, I'm Jackson Bain.
I'm Johnny Kolosinski. You might remember me from such podcasts as Serial, but not that Serial. This is one that's just an ASMR recording of me pouring cereal.
That's not a good one. That's not a good one. No.
It's a really good one.
No, it's a terrible one. Terrible.
I planned this out like 3 days ago.
No.
Damn it.
No.
This is Hi Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. This week we're going to be doing one of my favorite things and talking about Star Trek, specifically Star Trek The Next Generation, Season 6, Episode 5, Schisms. We have two wonderful guests with us once again, Dr. Greg Winter.
Hi, everybody.
And Dr. Courtney Nicholas.
Hey, everybody.
Yeah. So, Courtney, do you want to tell us why we chose this episode?
I've been waiting for a Star Trek The Next Generation episode since you guys have started this podcast. And so we chose this episode because I sat down and went through every single episode.
Literally.
Literally.
For anything that could possibly have to do with medicine.
I had multiple suggestions that were thrown out by all the doctors.
Hey.
No, I think the
Pushed
suggestions
aside.
will be used for a later
Yeah.
They will be
time.
used for a later time.
Not prioritized.
Correct. I think the reason why Courtney picked this episode was a little bit about sleep deprivation, and this isn't so much a discussion about what they got right and wrong, but it's definitely what we've gone through in our experience with not sleeping and all that stuff.
Yeah, so this is more of a comparative study than picking apart.
Correct.
We might have forgotten a little bit about the alien abduction.
Yeah, but you and I both had the same moment of, oh my gosh, it's this episode, as soon as we got into Act 2 and they started talking about the table.
But yeah. So, I mean, it all started out with Riker looking real tired with a lot of bags under his eyes.
Yeah.
That still very handsome.
Yeah, he looked very haggard, but very handsome in
Correct.
his seersucker pajamas.
Those pajamas looked fantastic.
I kind of want them.
So attractive.
So we open the episode with Commander Riker, who has not been sleeping well, and goes through things are going weird on the ship, and the cold open ends with basically, I'm really, really tired.
Yeah. And getting a lecture from Data didn't help either.
Yeah,
Or, sorry.
a poetry reading.
Yeah.
Yeah, I think that was probably the thing in the episode that spoke to me the most from a medical education standpoint, where there's so much stuff that you have to sit through, and you just have to be there and sit through it, and you have to be attentive, even if it doesn't apply to you, even if you're never going to use it again. You have to be there and be awake and be interested.
Or appear interested.
I will say his reclining pose, like Riker's reclining pose with his arms folded and just leaning back trying to close his eyes.
John Bender from Breakfast Club pose.
God, that was me many, many times during med school residency fellowship, you name it.
Yeah,
for people who didn't watch this episode before listening to our episode, this is the episode with Ode to Spot, and for the non-Star Trek fans, that's Data reciting a poem about his cat.
In iambic pentameter.
And it's as good as any of your friends' poems about their cats.
I thought that was actually the
pretty
high
good
point
poem.
of the episode. I love Star Trek. This was not a great episode.
I think it's a great episode.
I think my favorite part about at least that part was Greg talking about the story of him getting a lecture one-on-one.
Oh, yeah. That's why this part really spoke to me. There was a time as a third-year medical student, and I was on internal medicine, but also you do these little smaller rotations where you're sort of broken up, and I was in rheumatology. I think it was yes, it was rheumatology for sure. And my attending was like, well, we don't have any patients for the afternoon. Let's do a lecture. And she took me in her office, which was a very nice office, and did a one-on-one PowerPoint in a dark, warm office. And I was asleep in, I don't know, I mean, maximum I was awake for 10 minutes, and she gave an hour-long lecture.
So there's
Is it
nowhere to hide.
Like,
There's nowhere to hide.
all that happens in that is, like, you sometimes wake up. And so you do crazy things. You pinch yourself, like, you are, like, trying to twist your skin off. You are biting your tongue. You're doing whatever you can to stay awake. But it also doesn't matter. If you slept for 4 hours and you're sitting in a warm, dark room, you do not get to stay awake. And that is, like, that is what you see Riker doing. He is doing the nod off.
Mm-hmm.
And as crappy it is to go through it, it is the best sleep you ever get.
And
it is.
Well, and the thing to perfect too is the waking up without a start, because
Right.
that's
Oh,
what
yeah.
brings attention to you.
Right, yeah.
You have to learn how to wake up peacefully. Like,
yeah.
oh, I'm awake now.
I've been here the whole time. I know exactly what you're saying.
I did not fall
Greg,
asleep.
is
No.
it possible that so you were a resident, you said?
No, this was in med school.
You're a med school. Is it possible that this was someone who realized that you could just use an hour sitting in a dark room?
And you know what? That's entirely true. Maybe she could realize that. Except for, no, she could have sent me home.
Okay.
We didn't have anything to do.
Okay.
I will say that is like the worst thing as a medical student when they just go, why don't you just read for a little bit and then we'll get you when we're ready when we need you.
I used to do that to my medical students
It's
all the
the
time.
worst thing to do.
No,
though.
that's the best thing. But you, like,
just send them home.
you have to have a discussion with them kind of off books where, like, if I'm telling you to go to read, do whatever you want. I can't send you home. I might need you.
Yeah.
That's not true. I never will need you.
I never will need you.
But I might
to
need some
pretend
warm
that I need
bodies
you.
to do something.
There may be an
And
opportunity.
also, there are
to-
times where when you're a resident, you have to be there, so you can't like send the residents home. But
med students you could.
med students you could send home. I think the teachers that were better about that did realize that, and they would send you home.
Yeah.
Oh.
That's me seek.
Yeah. No. And then
But the other part, I only wrote down a few notes for this episode. But my favorite part is Picard has mastered the face of tolerance. Picard is just as tired and angry as everyone else in this poetry reading, but he is awake and he is nodding, but he is not enjoying it. And that's what a leader is, I think.
That's what we all strive for.
I mean, that is what we do after we get like a 25-minute presentation about a patient with a cold.
I'm going to go on record. That's why he's the best captain.
I don't know much. I've admitted this before. I don't know much about Star Trek. I will agree with you on that part, though.
Now, I can only speak to all of this from Data's perspective as someone who studied
As
theater
an android.
and has had people fall asleep during my performances. I'd say like my dad, but he's not listening to this because he hasn't made it this far into the episode. And we know, guys.
Does he just say, yeah, I started
know.
listening
Oh, yeah,
to it.
yeah.
Oh, it's
You're
so
doing
good.
great.
So great.
Yeah,
Mm-hmm.
I like it. I've told all my pharmacist friends. Yeah, we're aware of it when you fall asleep during our performances. Or even when you fall asleep listening on iTunes.
We see
Because
you.
it means you've gotten through another 6 episodes.
Thank you.
We appreciate it. Keep doing this.
Just remember,
if they-
remember to wake and subscribe and review.
Yeah. If you're still listening, hi everybody on
Everything.
Facebook, etc.
But they also mentioned that he didn't sleep for 2 to 3 days. I don't know how that feels. Well, actually, I do know how it feels not to sleep for 2 days. That's when things start hurting. I
Yeah.
don't know if you guys have had that sensation before.
I have.
Like, your body hurts, and that's when I actually started hallucinating a little bit, too. And that is the worst time to see patients.
It's the best time to write.
You get nauseous.
That's
Yeah.
the best.
Like Courtney said, you get nauseous,
Yeah.
too.
So I've not done a medical residency because I'm a guy who hosts podcasts. But I've done 48-hour theater festivals, and
Oof.
yeah, where we opt into this
Oh, I mean, we opted into this
for
too.
free.
Oh, okay. I mean,
It's
we make
kinda
as much
for
as
free.
someone who works at In-N-Out during residency. Actually, less than someone who works at In-N-Out. But it
Yeah,
still
I
hurts.
calculated it once $6.50 an hour.
Yeah, it's pretty painful. But the first 30-hour call was, I remember that very clearly. And that's when I drove on the wrong side of a one-way street. Or
There's
wrong
only
way.
one side on a one-way street, Jackson.
Wrong way on a one-way street. And I wondered why cars were driving at me. And I wasn't sure.
Were
until
you
I-
honking at them? Hey guys, why?
I think I did, and then I was like, "Oh crap! I need to get home and go to sleep now."
So I I think that Jackson and I were the last group of people that had unrestricted work hours, which basically meant that you stayed until somebody sent you home.
We were 30-hour cap.
We were 30 hours. I mean,
That's restricted.
That was the cap. 30 hours.
did you have unrestricted?
No. So we were the last year
But there
before they changed the rule to
That's what I'm sorry.
Yeah.
16 plus 4, I believe it is, or 16
Sorry.
plus something
I can be wrong.
to sign out. But we were the last class where we could do 30 hours uninterrupted.
That's nuts.
It
Because
was-
that doesn't seem like a situation where you would actively be able to learn.
And it's not a situation where you can learn.
No.
And the studies show that not only do you not learn, but you also do lots of dumb things.
Mhm.
The weird thing about medicine is that you have to experience things, and to experience things, you have to be
Put in
there.
your hours, yeah.
And so it's a trade-off between being present and also being awake.
Aware.
Oh, yeah.
Awake and aware, right.
And it's tough.
Did we have a work week hour restriction?
80.
It was
That's-
80, but
that's
no,
what it was.
but
Okay.
it was 80 averaged over 4
4
weeks.
Yeah.
So you could have weeks where you would do 100 hours of work
Mhm.
before, and then the following week they'll make it up by making it 60.
But I think we need to be careful about complaining about our work hours because people 10 years ahead of us are
Oh, yeah.
going to be laughing at this.
Yeah, they're like
when they
wusses.
worked 100
People 10
hours
years
a
ahead
week.
of us don't know how to use their iPhone.
I will say the worst part about when I did my 30-hour calls was getting random pages when I was actually got to put my head down to bed, and it was something like, there are 2 orders for Tylenol and we don't know which one you want to use. And I think after I got my 4th one, I said, "Do you hate me?"
You did something to them.
I know,
yes.
and I actually called them out, like, did I make you upset
You did
at some
something.
point? And they said, no, we're just trying to make it look better. I'm like, no, you just hate me right now. I hope I never come back here ever again.
My favorite
That
was
never happened to me.
I had
I'm
a
sure.
2 a.m. page for a
It only happened at
chapstick
one
order.
hospital.
Yeah, I'm sorry,
Ooh.
Courtney, you had a 2 a.m. page.
My favorite was I had a 2 a.m. page to write an order for chapstick.
There was a
I mean, that's
I assume this
critical.
wasn't while you were doing
There-
neonatal work.
There
No,
was
this was
a
pediatrics.
resident at the hospital I trained at that got fired because someone paged him at like 4 a.m.
Mhm.
and said the patient was sad. So this is somebody that is definitely trying to mess with this guy. Like,
Mhm.
I'm paging at 4 a.m. because the patient is sad. And he ordered a clown to bedside stat. And that did not go over well, and he got fired. Like, that definitely happened in my educational experience.
I don't even know what to say to that.
Right, exactly. What do you say to that? Like, everyone in that is wrong. Like,
I know multiple clowns that would have taken that call.
And I feel like I probably would have tried to order that at 4 a.m.
Yeah.
what do you want?
We
Nursing
all need
co-
a clown.
nursing communication order. Clown to bed stat.
Why are you why are you telling me this right now?
Yeah.
There's nothing I can do. But also, that shouldn't be your response. And those are the things you do when you have not slept for 2 days.
You
But
get
also, why do
real.
you have a chaplain and not a clown?
I did like how Greg asked when there was muscle tension in Riker's neck, which kind of doctor was going to handle it, an MD or a DO.
Yeah, there were massage moments.
I say that with the utmost respect for DOs. If I was going to have a primary care doctor, it would be a DO.
My
It's
primary
just-
care
it was
doctor
a
was a
very-
DO.
It was a very hands-on exam.
Yeah.
And she did all that scanning and was like, oh, you just have some muscle tension, and then started rubbing the back of his neck. Muscle tension is pretty easy to find if you just touch those muscles.
Yeah. What about the prescription she wrote for him? The hot milk toddy.
As a drinker, I have an issue with that. Because I can't think of a good liquor that goes with warm milk.
Whiskey, vodka.
Greg can think of
Bailey's? No,
Bailey's.
Bailey's.
Bailey's,
my
yeah,
curl.
but it still looked like milk.
Yeah.
It did. It didn't
I mean-
look like they put anything in it.
A White Russian is a pretty good drink.
Okay.
Yeah.
A warmed up white Russian.
You warm it up a little bit, you throw some cinnamon in there, you'll be fine.
So
a hot white Russian.
So if that patient...
What
you
are
are
you-
now
what are you-
eligible for a cabinet
What are you
position.
doing after this podcast?
So if that patient had, you got a nurse call, it's like, that patient's sad, would you write him a hot milk toddy?
I would say, why is the patient sad? Then you move on from there.
Yeah.
Both of them were clearly angry and both of them handled it wrong.
I think a good follow-up would have been like, what did you do to help make this patient not sad anymore? Cause
No, then you're going to get another page in about 45 minutes, right after you get back into REM sleep.
those days were rough. I do not miss doing overnight
in-house
Shut up.
hospital call. Courtney. Hey, I'm not the one who's going to get those calls anymore.
Well, I work in the NICU, and I just keep thinking about how many of my patients are sad on an hourly basis.
How do you know?
None of them. Do they have the
They're
capacity for
always
sadness?
I
They're
walk
just
through
hungry.
the unit, and there's crying everywhere.
That could be crying for many reasons. Anger, hunger,
Sadness.
sadness, because
I'm a
just
baby.
I'm a baby. It could be anything.
I kind of... So, Star Trek is doing this thing where they're doing a lot of short treks, which are just little cuts of what's going on in Star Trek. I want to see what's happening in sickbay when the chief medical officer isn't around and there's somebody who's been working for 80 hours.
So there's a lot of shenanigans that happen in any workplace environment. But thinking of the shenanigans that can happen when you can severely injure someone and just be like, and everything's fine. Like, there's no bet that you wouldn't take. There is no dumb thing you wouldn't try to jump over or through. It's just like, well, we can fix it. Doesn't matter what happens.
How many times has O'Brien broken his shoulder?
Or separated their AC joint.
Greg, by the way, has an ice pack from a one-wheel skateboard. His sling will be here tomorrow.
Well, in this episode, Riker, part of it was the aliens who abducted him while he's not sleeping, they severed his arm and reattached it.
But 2 microns off.
2 microns off, so they're not. No one's perfect. I
Yeah.
guess.
Nobody's nerfing.
Nobody's nerfing at all. Like, how did they know? Like, that's so minuscule.
2 microns is a really, really small thing. Like, that's nothing.
Yeah.
It's Star Trek. They know
In
everything.
fact, why did they even check it? Because it's not like he had a scar on his arm.
Exactly.
So what they scanned him and they're like, oh, there's part of your distal ulna and radius that are 2 microns.
They just have the backscatter because of, the Patriot Act is still in effect.
they get to scan everyone.
They also never really explained why his arm was amputated and then reattached.
because
Why
they
not?
Because aliens.
the aliens were
Oh.
kidnapping them to do experiments and figure out how humans live.
Or how arms work,
Or how
since
arms
they have
work.
claws.
They did have
I
claws.
mean, but their claws seem to have a radius and ulna. It seemed to be pretty similar anatomy.
Yeah. And then...
Why do you have these little dangly bits on the
I
end
wish-
of your radius?
I
and
sort
ulna?
of wish our scissors looked like fingers. Because that's the way their scissors look.
Longer, but more curved.
Right.
Is what he said. I'm trying to think what else I wrote down here. Everyone lost track of time for a long time. Data lost track of time for an hour. Like, you wonder, like, what did they do to Data?
He cut off his arm, put it right back on because they could do that with epoxy.
Yeah.
All right. I think the part, or maybe a thing that we can talk about. I don't know.
So this is a bad medicine podcast that is going to very shortly veer entirely away from medicine.
Yep.
When they are trying to recreate this room from memory,
Mm-hmm.
and there is definitely that, like, if you've ever been in that, like, night or day after a crazy night, and, like, kind of discussing things with people where different people can pick out different parts of the night, even though everyone doesn't really remember, but then as you're discussing it, things kind of start
You finally
coming
figure
back
out who
in.
kicked that hole in your wall.
Exactly.
Well, I'm gonna pull that back to medicine, though. That works in conferences. You know, when you have an entire family and you're giving any kind of news, people pull different parts from it. They remember different
Mhm.
parts. And so I'm sure your conferences are similar to mine, where it's good to have a big room of people because people remember different
Yeah,
things.
because you're going to ask them questions like, have you dreamed about scissors recently?
Exactly.
Yeah.
Or
Is this a tall table or a short table?
were there any smells in the room?
So they're doing all this stuff trying to figure out what happened, and they're trying to recreate this room that everyone is being tested in. And there's a big thing in medicine about restraints, and when they said, oh, the table had a restraint, and this thing popped up, and I was just like, that's not a restraint.
No,
No,
it is not.
it was a tray table.
Right.
It was a trick. I mean, as a guy who does have to use a lot of restraints at work because I get very violent patients that will try to attack me or spit at me, we do have to use everything else before we do the 4-point restraints.
But as a girl who flies a lot, a tray table can be a restraint.
Right, and actually, so that's part of it, is like, what is a restraint and what isn't.
Yeah.
And it's, and anything that impedes the patient from moving on their own is considered a restraint. And in different settings, different things are a restraint. So in some nursing homes or some residential care facilities, even something as simple as a bedside rail is considered a restraint because the patient can't adjust it themselves. And also, people can get hurt on those things because if they fall and they're weak and they get stuck in between the bed and the rail, it can cause damage. We've had patients that have died from things like that. And so, I mean, so you don't think of things like that as a restraint, but they are restraints. Normally, when we're talking about restraints in medicine, we're talking about like soft restraints of ankles or wrists, and I think we all have an idea of what those look like. It's like, you know, soft, kinky handcuffs, but medical. and so that's kind of what I thought when they were talking about restraints. And that's not at all what they show. They have like this kind of metal hibachi style grill that goes over the dude's chest.
That might be why they cut his arm off.
And oh jeez.
Can you imagine the aliens just doing hibachi style with his arm, just flipping up in the air?
Make the little volcano.
Yeah, make it hold the volcano and push it along.
Out of his beard.
I'm gonna have nightmares.
So
that's great.
It's like a very weird thing to think of that as a restraint, but also like that's the thing that popped up when they told the computer to make a restraint.
Yeah.
And it just like it's one of those like
it's not what anyone would think of as a restraint.
Right.
And we also know that the holodeck doesn't have family settings to only have family safe restraints, because one season earlier we saw
I was gonna say, how do we know that?
Yeah.
Oh, Johnny knows.
Oh,
Johnny knows.
I read all the fan fiction because we saw a character that had his fun little simulation with all of the officers.
I remember that one.
Where you said, "Oh, I don't like Barkley."
I didn't like Barkley.
Have you seen the Orville at all?
Yes.
Because there's a pretty aggressive simulation in the Orville.
Yes.
The one where
they're
done letting
Mocklin-
porn and it gets infected in the holodeck.
Yeah, the Klingon type officer.
I'm gonna say season 2, episode
like 3 or 4 early.
All right, I'll catch up.
I'm just guessing.
Season 2 of the Orville is great.
I mean, season 1 is great.
Season 1 is okay. Season 1 has great episodes, and
I mean, just like
season 1 of Star Trek.
Tunga is one of my favorite things. It's not good most of the time. It's nostalgic and great.
Yeah,
but it's not good.
When it's great, it's great. When it's good, it's okay.
Greg looks unsure.
I mean, that's the like when it's great, and when it's good, I'm still watching it.
Fair. I think the one medical thing, though, kind of bringing it back into all of this stuff,
Pulling it back,
is when Crusher talks about how everyone has increased serotonin because they all got a neurosedative.
Okay, I'm going to ask a question that Jackson has asked 3 times over the course of watching the episode. Guys, what is a neurosedative?
It's a sedative for your neurons.
Can you give
and
me
that is the answer that I've gotten every single time I've asked it.
Often the answers are in the question.
Can you give me an example of a neurosedative?
No.
whatever was in that hypo spray.
There we go.
A milk toddy.
A milk
Milk
toddy.
toddy. What's a hypospray?
A hypospray is magic injector. It's syringes, but better.
Just sprays it into their neck.
Transdermal.
A hypo spray is a thing that seems like it's going to be great and super futuristic until it actually came to being in real life, and it kind of is crummy and hurts. It like aerosolizes whatever drug you're trying to put in, and it pushes it through the skin at high pressure.
Okay.
And it hurts a lot.
So I think the closest thing that we've used in pediatrics is something called a J-tip, which is to start IVs. And it's filled with lidocaine, and then you open it up and it just sprays straight into your skin. So it numbs your skin enough so you can start an IV. But I feel like the J-tip, just based on your explanation, would hurt a lot more.
The most baller patient I've ever had was a little 7-year-old who I was sewing up her fingers, and I'm sure I was not doing the greatest block, as I was an urgent care doctor at the time.
Okay, so this was not palliative care.
This was not palliative.
I was
This
like,
is
that
someone-
poor 7-year-old.
Yeah, I was preparing for a downer.
No, this is a good story. But she had sliced her finger. I mean, whatever. People slice their fingers. And so she's in the office. And if you're going to sew somebody up, you want to do your best to numb that area so that, repeatedly putting a needle and drawing thread through it doesn't hurt them. But lidocaine, which is the drug that we use to do that, has a tendency to, it tingles a little bit. It's a little bit uncomfortable.
It burns.
Some people say that it burns. Either one of you had stitches?
Yeah.
Do you remember it burn? Do you remember that's the
Yeah.
worst part of your experience?
Yeah.
You guys are horrible people. Anyway,
2 out of 3 doctors say it burns.
Yeah, it burns.
That's right. One of them is right.
It's one of us.
So normally when you're doing something like that, you try to you want to numb up that area with as few injections as possible. We call it doing a block. You like kind of move away from the injury, try to stop those nerves from being from continuing to have sensitivity. So you inject them with lidocaine. So
Make the nerves go to sleep.
Thank you. That's a better way. So you're trying to make the nerves go to sleep with lidocaine.
A neurosedative.
Oh shit!
Oh, count it. Count it. Oh, that's so good.
That's great.
I'm sorry, continue.
So I injected her, and you have to normally do 2 of these little blocks. Later, when you learn better, you can do just 1. But so I did the first one, and she is screaming bloody murder. Her dad is there. Her dad doesn't even want me to do the second one. I'm like, there's no way I'm going to do this without injecting the other one. And she's like, I don't care. It hurts too much. Just sew me up. And I was like, okay. And then I just did it.
You let a 7-year-old tell you that? And
I mean, I
said,
definitely...
okay.
If someone's telling you not to inject them with something, you do not inject them with something.
She's the
That's
boss.
very true.
And, her dad is the boss, who was like, don't do it. And I was like,
Okay.
I said, I will try. And then she was like, she tolerated that much better than having another injection. That was the most baller patient. It's like, no, don't! Just do it! I was like, oh, I don't want to do that.
It's gonna hurt a lot. It's not gonna be fun. And then, I mean, so since we did talk about neurosedatives, she said to counter it with the neurostimulant, which that I'm pretty sure what that is. I didn't say that sentence correctly, but that's okay.
The thing that would counter a sedative is a stimulant.
Correct.
Right. So it's
Done.
Concerta.
Concerta. That's good. That's math. That's fine. I was thinking cocaine.
Yeah, he's
mean,
got
what's-
cocaine written in his notes right here.
Yeah. Cocaine.
That's
What's the
like,
stuff that Chef Chelios does off the wet floor of that bathroom?
Okay.
That's the one.
Yeah, that's the stuff.
Taking it back to lack of sleep and residency, there are stories that residents used to take speed to get through training and medical school and everything, and it could be one of those urban legends, but I like to believe it.
I mean, my friends in med school that had access to people that people that lived in Mexico or people that had Adderall definitely used that.
Yeah, if there was anything that would be considered a performance-enhancing drug in med school, it was Adderall. I mean, we had a lot of kids using that, and that was like the first exposure I had to Adderall, or at least people taking Adderall. Not from
Was it also in your notes?
No, that was not in my notes. But there were a lot of kids that used Adderall, and then they would try to sell it to other students to get a leg up on the other med students so they can get a higher rank.
It is definitely a stimulant, and it helps keep you awake. It also stresses out your heart. It also makes you not want to eat. It also makes it difficult to sleep. Sleep is something that your brain needs. It is a restorative function. It is not just, oh, you're not awake anymore. So it's things that people are doing to sort of keep up with their competition, but they probably don't realize the downside of what they're doing as well.
Looking at this episode, specifically like the first 2 acts, is it possible in those first 2 acts that it was just Commander Riker doing a butt ton of Adderall?
No, because in the first act, he was falling asleep during the poems.
Okay, there we go.
Although,
He could have
those
come down.
poems were boring enough where, even on an Adderall binge, you
And
probably
it
would
was
have fallen
that
asleep.
was the 9th poem.
But to be fair, he could have been coming down from it too, and then really getting it. But those poems stunk.
Except for
No,
Ode
they
to
were-
I
Spot.
like Ode to Spot, man.
Ode to
That's
Spot's
classic.
pretty great.
You know, Jackson,
I'm not one
when
to
you
talk.
don't know what you're talking about,
I'm not going to talk.
as far as poems in Star Trek The Next Generation, that one's pretty
I don't think you've seen Spot.
I
Spot's
love
pretty phenomenal.
Spot is a yellow... Spot is basically Garfield.
Yeah.
Jim Davis should have sued Tunga.
I love the vocabulary in Ode to Spot. I feel like anything where I might need to pull out a dictionary and look up 60% of the words, it's art.
It's a good poem.
I mean, I at least
You
know
should
the
have
person
seen,
that's
like,
trying to
all
tell
of the
me
theater
I
I did in
understand
college.
it doesn't know either.
God, we have digressed. digress.
You know, that's
we
kind of what we expected for this episode.
Yeah,
to
we
be
called
honest.
this one. I've got a question about Troy's psychiatric.
Acumen?
Yeah. In the event that somebody's having a really bad, probably what to me looked like PTSD, is the best thing to do to get 5 people who are having the exact same experience in the room and recount it.
I don't know enough about.
I don't either, but there's definitely
Treatments.
group therapy kind of situations where that may be helpful, but there's always a risk that you're going to trigger them and send them into a different path that is expected. The other issue that sometimes you get if you have a lot of patients with the same kind of thing and you put them into the same place, which we do have with suicidal patients in my hospital, is if they're all in the same area, they start getting ideas off of each other and bouncing them back and forth, and then they become more repeat customers than you would want them to be.
Okay.
So that might be the potential downside that I've seen a few times. However, group therapy does work in certain situations. However, in this, who knows? Just know that-
This was like having them all sit
abstraction.
down with a detective and say, "Hey, let's talk about it."
From sort of a medical legal standpoint, you would never do that. You wouldn't have somebody who is not part of that therapy group participating in that therapy in order to figure something out. I think that's the thing that happens in movies a lot too, where they're like, oh, we're going to interview all these people. It's like, you can interview them, but they all have to be separate. It can't be like part of therapy.
Mm-hmm.
But I don't feel like this was therapy so much as there was an inkling idea that these people had gone through the same thing and don't have a memory of that. And so getting them together and having them talk about it, kind of like you were talking about, Greg, with the night before that maybe you don't remember, and the shared experiences and people trying to piece together
I don't remember that.
memories with wholesome. Exactly.
But as a counselor and as a medical professional, is that her role?
On a ship in the middle of the galaxy, possibly.
I will defer to the Prime Directive. I think, to answer your question, I think if Troy's acting as a counselor,
Mm-hmm.
inappropriate in that setting, maybe.
Yeah,
Because-
in our setting, in 21st century medicine,
Yeah, and
it
so
would
like
be-
it would be. I think it would be okay to get a group together and talk about their shared experiences and kind of work through that.
but not
would
have your
it be
therapist
right
there
to do that as a therapist and then use that information
in an
to
investigation.
other things and like share that with other people? Because one of the big things about therapy or any medicine is that there's doctor-patient confidentiality. When people are in group therapy, there's some understanding that there's confidentiality between those people that are there, but you would not then go share that information with the captain and the security officers and all that other stuff.
And a cyborg.
He's not a cyborg.
But
he's an
being
alien.
on a ship is very different, and
But I would assume that in the military there would be.
I've said this many times. It's not a naval podcast.
So
Yes, Johnny? How are you going to say
generally,
this?
I have a question that I ask.
I don't know how you're going to fit that question into this.
I
but
know.
Go for it.
No.
I'm gonna
Well,
go with it. Well, first, do we have anything else we want to discuss before?
I wrote that the missing ensign had exophthalmos.
Well, we could talk about the lack of blood spurting as Riker snatched her away with those tubes coming out of her arms.
Yeah. So Riker rescued a
Ensign?
missing ensign.
Red shirt.
She was wearing a blue dress.
Yeah, it was a blue dress.
She was.
Red
Look, all
shirt.
of you remember
It was
that.
a red shirt.
Well, she was snatched out of her bed, probably.
And
And-
everyone wears a blue sleeping gown.
In Star Trek, they do.
Or
Riker
seersucker
did.
pajamas.
Seersucker
I know,
pajamas.
Riker.
Really wants your second pajamas, but she had like 8 different IVs running into her arm.
Yeah. Like
I mean,
Matrix style. I guess.
so-
Yeah.
Exactly, not necessarily IVs. They
Right,
are
that's the
tubes.
thing. So we're assuming that they're IVs, but also they could be in soft tissue, they could be in muscle. Who knows what those
They could be
aliens are doing?
tentacles, who knows?
They think scissors are claw things.
Yeah.
So they don't know what's going on.
But none of them, when they were removed,
There was no blood.
But
There was no blood.
I
We
mean,
don't know
so
when
if
it
it's,
was
if
attached,
it's
though.
if you aren't in a vein or an artery when you pull that out, there's
Nothing
not going to be a
happens.
ton of stuff. I mean, there's going to be some oozing, but it's not like.
okay. So
There you
Medically
go.
for
accurate.
once,
Medically accurate.
there
Enough
might have
blood?
been the right amount of blood.
It's just we don't know what they're doing, and in a lot of other situations, we know exactly what they're trying to do.
We should watch The Matrix.
We should watch The Matrix.
It's 20-year anniversary.
Is it really?
Wow.
For, like, another 5 weeks.
And it's in theaters right now.
Is it?
I think so.
Okay. So I'm going to ask 2 questions. I ask them a lot. I don't know how much they're going to apply this week. The human centipede bills itself as being 100% medically accurate.
Are we comparing everything to the human centipede?
Yes,
Correct.
we are.
Because that's the only thing that billed itself as 100% medically accurate.
If the human centipede is 100% medically accurate, how medically accurate would you say that Star Trek The Next Generation Season 6, Episode 5, Schisms is?
Pass.
What's a schism?
Actually, we did not touch on that. What is a schism in this setting?
That's a great question.
I mean, I don't know the answer. Isn't it like sort of
It's like
an
a break.
idea of thoughts that go together? Isn't that what it is?
Well, a schism is like a break between
I thought
things.
it was like the Grand Canyon.
It is a split or division between strongly opposed sections or parties.
So it's
One of us studied liberal arts.
the opposite of the thing that I said. I'm
Yeah.
willing to be wrong. You gotta be wrong sometime.
Yeah. Caused by differences in opinion or belief. There was nothing about this.
Nothing about this was a schism.
a schism. Everyone believed they got abducted by aliens. But,
So it was not linguistically accurate,
correct.
but medical accuracy.
I feel like we must be missing something.
No, I think
Star
that
Trek
somebody
is
just had
always accurate.
somebody just had a poor understanding of what a schism was. Somebody had my understanding of what a schism was.
Language changes over the centuries.
I will say this also, like, when Picard hears about what's happening and he's sitting in his captain's chair and he's surprised and concerned, he wears that well on his face. You know he's surprised and concerned, but also you know he's in charge.
Because
Best captain.
Patrick Stewart is amazing.
Yeah, best
Yeah.
captain. Best captain.
Hands down.
I will go to war with anyone who says otherwise.
Me too.
I'd go to war against them.
All right.
But what would you say the percentage would be?
13.5.
Really?
There was sleep involved.
Not gonna
Sleep
best
exists.
that.
Sleep is a thing.
You know what? I want to give them bonus points because the bags under Riker's eyes are amazing.
Okay,
in this
I'm so
episode.
glad that you brought those up because I do. The one thing that I did not mention, we were talking about the early scenes, was Riker's appearance with the bags under his eyes, and they were like double bags. And
Oh, yeah.
HD makes them that much better. And then the hair, where Riker typically has really good hair, and in this episode it was just all over. That was me for like the first 7 years of my training. What am I saying? That's still me.
Yeah, I have double bags. I have perpetual double bags.
I don't know what normal
You do,
sleep
I can
is
see them
anymore.
from here.
Thanks.
Yeah, I don't know what normal sleep is. Like,
Mm-mm.
that's great for traveling though, because I never get jet lag.
Oh, I fall asleep before we even take off.
I work from home and I still look this tired.
Oof, that's rough.
Jen, we should talk.
Yeah, we need to have a talk after this podcast.
So sleep hygiene is important.
But yeah, I don't know. I'd say higher than 13.5. I'd say at least
The alien abduction did not push you past that.
No,
No.
but if we're talking about medicine,
Okay.
like the things that are medical,
the lack
what
of
is
sleep.
accurate, what is not accurate.
The
Lack of sleep is real messy. Lack of sleep does a lot of stuff to you. It
gives you tension in your neck.
gives you neck
That
tension.
needs a physician massage.
It affects your memory. It affects your blood pressure. It affects it makes you high risk for diabetes. It does a lot of stuff. You should get a good amount of sleep.
So I'd say 50.
I mean, but also, if you're not getting sleep because you're being abducted by aliens and having experiments done on you, that's a little bit different than if you're just not going to sleep.
You
Yes.
got other problems.
You have
Yeah.
other problems.
The lack of sleep is least of your problems on that
Well, and we've talked a lot about through medical training how there's a lot of lack of sleep, and Jackson, you driving on the wrong side of the road and things of that nature. The powers
the wrong
that
side
be,
of a one-way street.
the wrong side of a one-way
one.
street.
Thank you.
I ended up on a bike path once, but it wasn't during medical school, so I can't blame it on that. The powers that be in medical training have made it mandatory to have, what did they call it? Sleep training?
Yep.
Or lectures regarding the importance of sleep. Something of that nature, right?
Talking about microsleep and sleep deprivation
Right.
and sleep hygiene.
And so what that boils down to, typically for most training programs, is an hour, maybe, at the beginning of the year.
Which is good because it means you're probably awake for it.
Hopefully.
I mean,
And then
that's
it, though, typically.
In truth, it is better than not having any of it. And I think because of it, people have realized how much of a big deal it is. I mean, like, I still think as protected as they make it, it's not protected enough because there's still this kind of culture in medicine where if you're not willing to be there and go the extra mile and do whatever you can, then you're not as good as somebody else. But I'm please do not take this as the right quote, but I think it's like after 24 hours of no sleep, you're basically like a 0.08 blood alcohol level. And that
you're legally drunk.
You're slow.
Right. And so like that affects everything you do, right? It affects your judgment, it affects who you text, it affects like all of that stuff. So imagine if your doctor is like that, and if you're at a hospital where there's doctors that are being trained, likely there's sleep deprivation.
Yeah. So yeah.
Not even being trained in some areas. Once you're past training,
and
get worse.
that's the truth.
Now
Once
we're no longer protected by
Exactly.
our.
And that was the thing that when Jackson and I were going through, we were that last group that had non-protected hours up to 80 hours a week.
I was gonna say
right?
again, not true.
Yeah. But so that was a very weird thing as they were trying to do the handoff because it's like to make those hour adjustments, someone's got to fill the gap, and the seniors don't fill the gap. We did.
Yeah.
So like you come in
because the newbies couldn't work those
Right.
long hours anymore, so we got to be the ones to make up for the hours that were missing from the new people.
Right. And also we still didn't know what we were doing, and we were sleep deprived. So it's just a very weird thing.
Yeah. So yeah, we did a lot of talking about sleep today.
Yeah.
Yeah.
This
I don't know how you're going to make this more medically accurate about sleep because all this inane rambling, lack of sleep.
I
There
feel like
we
I
go.
need a nap.
Yeah.
I feel great.
So I'm
Maybe it's because I have Jackson's notes.
Generally, I would ask a question: how do we make this more medically accurate? But I don't think we do because it's Star Trek, and it wasn't well, and it's perfect.
More bags under Riker's eyes.
Yeah, more like 8 times more bags.
Yeah.
But I feel like the things that we wanted to discuss were kind of right, just not to the same extreme. And none of you guys were, to the best of your knowledge, kidnapped by aliens and had arms removed during your residencies.
I didn't say that.
Okay.
I'm not going to comment either or.
The aliens and I have come to an agreement.
Sign an NDA with the aliens there.
If any of you have been kidnapped by aliens and have your arms removed during your residencies,
This is not a Maury Povich episode.
Maury Springer.
Maury Springer.
Clearly, I have not slept enough.
I would watch Maury Springer.
You can, if you have had your arms ripped off by aliens, you can send us an email at hieverybodypodcast@gmail.com or follow us on Facebook, Twitter, or Instagram at hieverybodymd.
Not ripped. Severed cleanly.
Severed cleanly. It could have been ripped and then reattached cleanly.
Much harder.
I like how you just said it so slyly. You just
That
said
was the most serious look I've gotten from Courtney this entire episode.
Yeah.
She's done a lot of eye rolling.
Okay. Final thoughts, you guys.
Yeah, final thoughts on Star Trek TNG Schisms.
Silence.
This was my least favorite. I love The Next Generation, and I did not like this
See,
episode.
this one stuck with me as a kid.
We're going to talk more after we stop recording.
We're probably going to talk more about Star Trek in the near future as well. But yeah.
I feel like crossover with Independence Day and the father that got kidnapped by aliens.
And Brent Spiner.
Was he in
Brent
there?
Spiner.
Yeah, Brent Spiner's the guy who
He's the
gets his face
scientist.
pressed up against it. The scientist.
You're right.
with the long hair. Yeah.
Can this episode
Can we
be
connect it to
titled
Independence
Courtney
Day?
Learns Something?
Courtney learned a thing.
That should be the
every
subtitle
day.
of this episode.
You learn something new every day.
No.
No, it's Courtney Learns Something.
I'll take it.
Yeah. I think that's
Jackson, any thoughts?
No, I got nothing. Like I'm just sitting here just basking in everyone making fun of each other.
All right, folks. Well, we will be back next week with more Hi Everybody, a Bad Medicine podcast. Thank you for listening. Please tell everyone about it because we love it when you listen. Thanks, guys. Bye-bye.